try and help us remember all of these bony foramen and the orientation of each, we can remember the mnemonic Hi, Jill, Sorzo. That's a capital H with a lowercase I, saying hi, and then Jilsorso. So the H gives us the hypoglossal canal. And the reason the I is lowercase is because we are going to ignore it, because the next letter that we want to focus on is the J, indicating that this is the jugular foramen. The hypoglossal canal contains cranial nerve 12, the hypoglossal nerve, and the jugular foramen contains cranial nerves 9, 10, and 11, the glossopharyngeal nerve, vagus, and the spinal accessory nerve, respectively. Next, we have the I in the acronym, HJI, and I stands for the internal acoustic meatus, in which cranial nerves 7 and 8 are going to run within. And that makes sense because the vestibular apparatus and the cochlea exist inferior or within this petrous portion of the temporal bone, so it only makes sense that the vestibulocochlear nerve, cranial nerve 8, will travel within it. Furthermore, cranial nerve 7, the facial nerve, is also going to travel within it, entering the internal acoustic meatus and traveling within the facial canal before exiting the stylomastoforamen at the base of the skull, seen between the styloid process and the mastoid process of the temporal bone. This is the stylomastoid foramen. Now, next we hit the L. So H, J, I, L, and L stands for foramen lacerum, in which nothing of significance is really contained within here. Next is the S, foramen spinosum, in which we have the middle meningeal artery. Then we have O, foramen ovale, in which the most significant structure here is going to be cranial nerve V3, the mandibular division of the trigeminal nerve, which has mixed innervation containing both sensory and motor fibers. R is foramen rotundum, and here we have cranial nerve V2, the maxillary division of the trigeminal nerve, running. Then we have the superior orbital fissure, and within this superior orbital fissure, we have cranial nerves 3, 4, 6, and V1. That's the oculomotor nerve, the trochlear nerve, the abducens nerve, and the ophthalmic division of the trigeminal nerve, respectively. Then the next O and the final O is the optic canal, in which the optic nerve will run in, as well as with the ophthalmic artery, which is a branch of the internal carotid artery.